Curioso, and welcome back to the Welsh History Podcast, episode 262, Healing the Valleys, Medicine in Wales, 1890 to 1912. We've talked a bit over the years about medicine and health care in the history of Wales, going back to the Middle Ages with the monasteries and their role in helping to protect people, how that all worked in the Black Plague, and then going into the Renaissance and into the early Enlightenment period where medicine changed again and understandings about the body and healing change slightly. But now we're going to talk about how it changes dramatically in this century and how things start to change, keeping in mind that in the early 20th century, things are still not completely clear about bacteria and its role in medical healing and hurting, in the way infections work, and how specifically disease is spread. And that only really comes after World War I. We start to get into the idea about biology. We start to look at microorganisms and their role in this. And those things, we're not there yet at this point. So keep that in mind as we go through this. And that's important to start with. Today, we step into a Wales that is both familiar and, of course, deeply unsettled. A land of coal dust and chapel bells, of tight-knit communities and relentless labor, but also places where illness was never far away, where the cost of industrial success was measured not by output, but also in human lives. This is a story of the medicine in Wales between 1890 and 1912. A time before the NHS, before universal healthcare, before the idea that healthcare might be something that could be guaranteed. And yet, in this period, we begin to see something remarkable happening. The foundations of that future being built, often not by governments, but by communities themselves. By the end of the 19th century, Wales had been transformed. South Welsh coalfields were one of the most productive industrial regions in the world. Ironworks, collieries, railways shaped the land and drew tens of thousands of workers into the rapidly expanding towns. Places like Merthyr Tydfil, Aberdare, and Rhondda grew and at an extraordinary pace, but infrastructure struggled to keep up. Housing was often built quickly and cheaply. Rows of terraced homes packed with families existed together, close and communally maybe valuable, but from a healthcare perspective, not great. It was not uncommon for parents, children, and sometimes lodgers to share only a few rooms amongst each other. Picture Victorian terraced housing in Britain and imagine instead of, 3 or 4 people, you have 10, and you've got sort of the understanding. Water supply could be unreliable. Waste disposal was inconsistent. And we've talked a bit about this. In some areas, sewage systems were incomplete or non-existent, and that all created part of the problem. The results, of course, were predictable. Disease in that environment thrives. One late 19th century report captured the situation bluntly. Quote, "In many of the mining districts, the condition under which people live are such as to invite disease." End quote. This is not an exaggeration. Tuberculosis spread easily in crowded homes. Infectious disease moved quickly through communities where isolation was almost impossible. And then there was, of course, the work itself. Mining was dangerous in ways that would be immediate and visible. Collapses, explosions, and crushing injuries were constant threats. But there were also slower dangers. Coal dust filled the lungs of workers over years of labor. Men developed chronic coughs, breathlessness, and long-term respiratory illness. They often continued working until they physically could not because of this problem. Life expectancy in industrial Wales lagged behind rural areas. Infant mortality was high. Illness was not an occasional disruption. It was a constant presence. We've talked about all this before when I did an episode a few months back where we discussed how some of the changes were being made to the health and safety in the mines, and when we talked a little bit about the overall problem of these communities and how they were built up. However, we're going to go much more in depth to this problem. The reality that shaped Welsh medicine at the turn of the century was one of not occasional disruption, but the fact that illness was a constant presence and a constant way of losing people and workers. If industrialization created the problem, public health reform was the first serious attempt at a solution. By this time, medical understanding was changing rapidly. Acceptance of germ theory reshaped how disease was understood. Illness was no longer simply attributed to bad air or vague environmental causes. It could be traced to specific organisms and conditions. That shift had enormous implications. Local authorities began appointing medical officers of health. These officials were responsible for tracking disease, improving sanitation, and advising on preventative measures. Their work focused on practical changes, improving sewage systems, securing reliable clean water supplies, and monitoring outbreaks. A key component to any dealing with emergency issues is having someone on board who can quickly diagnose a problem and come up with solutions. That doesn't mean they have preventative measures necessarily, but they at least have ways of dealing with it as it happened. Although resistance remained in some communities, the long-term effect was clear. Large-scale outbreaks became less frequent because of it. Tuberculosis, however, remained stubborn. As one medical journal at the time noted, quote, "Consumption is a disease of the poor, and it spreads as closely associated with bad housing and insufficient nourishment," end quote. This was, of course, not just a medical issue, it was a reflection of the inequality that was going on. One of the most significant reforms came with children. The education legislation of 1907 introduced compulsory medical inspection in schools. By 1908, children across Wales were being examined for the first time. Doctors looked for signs of malnutrition, disease, and developmental problems. And the findings were alarming. A government report observed, quote, "The physical conditions of many children attending school is far below what it should be expected in a civilized society," unquote. This moment matters, because for the first time, the health crisis was visible not in statistics, but also in children. Public health was no longer an abstract, it was undeniable. Despite growing awareness, access to treatment, of course, still remained uneven, as you would no doubt understand. Hospitals in Wales were limited and often concentrated in larger towns. Most were voluntary institutions funded by donations, subscriptions, and philanthropy. They were not universally accessible. Patients often required letters of recommendation or proof of contribution in order to be looked after. There was also a cultural hesitation. Hospitals were sometimes viewed with suspicion. For many, they were associated with death rather than recovery. As a result, much medical care still took place at home. You can see some common things that are kind of happening in our modern day and around this particular issue. General practitioners traveled to patients, often covering wide areas. They carried basic equipment and relied heavily on experience over knowledge. Treatment options were limited by modern standards. Nursing, however, was changing. Following the reforms under Florence Nightingale, nursing began to professionalize. District nurses became essential, particularly in rural Wales. They provided care, advice, and vital links between the medical knowledge and everyday life. Even so, access depended heavily on the ability to pay or belonging to a system that provided support. And that is where the Welsh communities began to innovate. In the absence of universal provision, workers created their own systems. Across coalfields, miners established medical aid societies. They were collective subscription-based schemes. Workers contributed a small portion of their wage each week, and in return, they received access to doctors, medicine, and in some cases, hospital care. This, however, was not charity. It was organized, structured, and based on mutual support. One contemporary observer described it as, quote, "The workmen provide for their own medical attendance, a system of mutual help of the most practical kind," end quote. If we want to understand how Wales helped shape modern healthcare, we need to understand and focus on one place, Tredegar, A small industrial town in South Wales built on coal and iron and facing the same harsh realities that so many other communities in the valleys were dealing with. Dangerous work, often frequent injury, and illness that could strike at any time and be widespread, and very little in the way of reliable, affordable medical care. By the late 19th century, systems of charities and private payments were simply not enough for working families. Access to a doctor could depend on whether or not you could afford it that week. So in 1890, the workers of Tredegar created something different. They founded what became known as the Tredegar Medical Aid Society. It was a simple idea, but a powerful one. Each worker paid a small weekly contribution into a shared fund. In return, they received access to medical care. Similar, in a way, I guess, to medical insurance. We mentioned it a little bit ago in this particular episode, but this is a much more involved one. Not just for themselves, but also for their families as well, something that would be unusual. Doctors were hired and paid directly by the society. Medicines were provided, and in many cases, hospital treatment was included. However, keep in mind that this was not charity, rather it was organized, structured, and collectively owned. One contemporary observer described it as, quote, "The workmen provided for their own medical attendance, a system of mutual help of the most practical kind," end quote. That phrase matters because what was happening in Tredegar was not about access to care, it was about control. Doctors were no longer distant figures serving only those who paid them. They were accountable instead to the community. Healthcare became something shared, something built by workers and for workers, and crucially, something that could preserve dignity. There was no need to beg for treatment, and therefore no reliance on charity to help you. If you were part of the system, you were entitled to care. That distinction would prove incredibly important. Tredegar was not the only place where medical aid societies existed. As we mentioned, similar systems appeared across industrial Britain. But Tredegar stood out as it was particularly well organized and it achieved broad coverage. And it provided a level of care that was, for the first time, remarkably comprehensive. In many ways, it functioned as a prototype, a working example of what a larger system might look like. And in Tredegar, one young boy grew up watching this system in action and understood it. That boy grew up as Aneurin Bevan. We'll talk a lot more about him in the coming years. He saw how a community could come together to provide health care. He saw the importance of and dignity of access and of collective responsibility. In later decades, when he stood in Westminster to introduce the National Health Service, those lessons were still with him. So when we talk about the origins of the NHS, we often look at legislation to govern and to policy. But in truth, some of its roots lie here, in a small Welsh town in 1890, where workers decided that they could not wait for help and build something themselves. A social system which evolved. Medical sciences also advanced rapidly. Surgical techniques improved with the adoption of antiseptic and aseptic practices. Infections that once proved fatal now were becoming survivable. The discovery of X-rays in 1895 introduced a new way to diagnose internal conditions. Doctors could now see fractures and abnormalities without invasive procedures. Laboratory medicine began to develop, allowing for more precise diagnosis. However, access to these advances were uneven, as you can imagine. Urban centers adopted new technology more quickly. Rural areas often lagged behind. This has not changed that much. Even within industrial communities, access depended on local resources. So while medicine was improving, its benefits were not yet equally distributed. In 1911, a significant change then took place. The British government introduced the National Insurance Act, led in part by David Lloyd George. This legislation marked one of the first steps towards state involvement in healthcare. Under the Act, working men below a certain income level were insured. They were gained access to general practitioners, and they received financial support during illness. The system was funded through contributions from workers, employers, and the state itself. Lloyd George framed it clearly by saying, quote, "It is not charity, but a right. secured by contributions from workers, the employers, and the state, end quote. For Wales, this was transformative. Large numbers of industrial workers were now included in a national system. But of course, like any system like it, it had its limits. Women were largely excluded, children were not fully covered, and hospital care remained outside its scope. Even so, the principle had changed. The state had accepted some sort of responsibility. By 1912, Welsh medicine stood at a turning point. Old systems of charity and private care still existed, but the new approaches were emerging. Public health reforms were improving conditions, and medical aid societies demonstrated the power of collective provision. Scientific advances were reshaping the way treatment was done, and the state began to intervene in how healthcare was carried out. Wales had experienced both the harshest effects of industrialization and some of its most innovative responses. When the NHS was created in 1948, it of course did not appear from nowhere. It was built on foundations of decades of work, investment, and training that helped that become a reality. And socialized medicine, which came out of it, drove a lot of what we look at as the modern way that we deal with healthcare today. It's something that has crossed many different countries since then, so it's incredibly important, and it's massively significant that it happened in Wales, that Wales is the point of where this was built. And of course, it didn't mean that everything was great and wonderful. It meant that things were passable, that you could do a level of consideration towards the health of someone without necessarily being really concerned too far. The industrialized societies of Wales and its companies, owners, and governments were not completely set in a pattern that would lead us to socialized medicine easily. Typically, they were dragged kicking and screaming more often than not. And it would take decades and decades of work by many, many people to get basic workers' rights, basic women's rights, basic rights for children that were built over these periods in the 1800s and early 1900s that then developed into the modern system post-World War II. All of that to say we're still a long way from everything working with some equality for everyone, of course, but to say that there is some sense of fairness, I think is, to put it bluntly, fair to say. I think when we look at the way medications and medicines work, we will see more change coming. It's still a ways away from our modern system, but it's not as far off as it was prior to this. And I think that's important because what it means is that we're on the precipice of major discoveries, major understandings, and developments that actually extend our lives in ways that we would never have imagined even 50 years prior to that. And even in areas which are isolated and rural in most Western world countries, there is an ability for those people to access healthcare, to access medicines, to access ways of getting treatment so that someone living in a little village in England or Wales or Scotland or Ireland or Canada or France has the same access, at least, to medicine. They may not have exactly equal access, but they do have access to it. And I think that's an incredible step forward for society. And fundamentally, it protects us all from the worst of things. All you have to do is look back at the last pandemic to understand just how drastic things can go badly without proper medical care. You know, the millions of people that died, some of which did not have to die because of proper medicine. The fact of the matter remains is even more would have died without medical inventions that we had and medical movements that were created because of these changes that were happening. By the time of the Spanish flu, a lot of things that were done during the early part of COVID were done in the Spanish flu period as well. and it probably helped save people's lives, much like it did in the COVID periods. It's so often preventative medicine is kind of ignored, and it is the one thing that we can do that could probably help the most for our medical professionals. And the more we're willing to do it and will do it, the better it is for ourselves, but also for the system on the whole. Because the less we're going to see a doctor, the less we're going to see a nurse, the less we're going to our pharmacies and chemists to get prescriptions, the better it is for society as a whole. The more you can deal with the emergencies and the problem people and avoid people dying in unfit situations simply because they couldn't get to a medical professional quick enough. All of these things are things that we need to consider in the long term. It's a political discussion, not one suited for this podcast, but it is something I've thought a little bit about over the years. And it is something I think, have to look back with some level of gratitude towards the way that miners and workers in this early 1900 and late 1800 period for themselves decided to set up what amounts to the early stages of a social network that will help preserve the lives of everyone. And I think we should be and are grateful for it, for sure. With all that said and done, thank you all for listening or watching today. If you have any questions, comments, or concerns, you can always reach me at the Welsh History Podcast at gmail.com. If you want to help the podcast in any way, you can always reach out to me at patreon.com/Welsh History. I'm on social media at pretty much every social media site, usually as Welsh History Pod, but on Facebook, being the one exception, it's facebook.com/Welsh History Podcast. With all that said and done, thank you all once again. Have yourselves a wonderful rest of your day. Dolich amorando tan I tro nesaf. Welsh History Podcast is a member of the Evergreen Podcast Network. To find more information on them, you can do so at evergreenpodcasts.com. Thanks for listening.